MeghalayaPost.news.
Kumsiban taban penklan ya kajing sumar Paidbah hadu kisnong kibajengai barban pen sepreng ya ke khubor halor ka koj ka khia nagalyang ka Glenmark Foundation hakajing trilang bar ka Society for Action in Community Health SACH kala palat Paidbah ya ka kali ajing sumar ka balatip kum ka Health on Wheels ka Mobile Medical Unit ka bandit ajing Shakri Ïaki Kisnong kendong kani ka project katemu ban penklan ya ka rokom trikam jong ka koj ka khia hakisnong barban penti kena bagi Paidbah kiyo ya kajing sumar ka bapaka kani ka sinjam katemu ban penpoi ya kajing sumar hakumbar potli Kisnong Haribhoi district Mobile Medical Unit kana ajing Shakri Paidbah akhdop jong kisnong khamtami ki kenthai arman ki khna ki rirong ba batkiwe pat ki badan hagajing e banyo jing erap hakapor ka babyang batkani ka program kalong shibanta nagajing thumu ban panjana ya gajing Shakri Paidbah hakithan yong kendong bat ban pentikna bagajing sumar ka poi shaki badon kamtam ya kate ki kali Health on Wheels lapalat Paidbah manta ka sngi haum sning daw Dr. Celestine Lengdo MLA kom sning constituency kom ukongsan hagani gajing elang taidon langru Sampat Kumar Principal Secretary ka Sarkar Jila ka Shweta Monjal Chief Communication bat CSR Officer ka Glenmark Pharmaceuticals ukepi Rajandran nagalyang ka SSCH lembat kiwe kinong turei jong katanat ka koj ka khia habakran ka jingelang Dr. Celestine Lengdo ulo ay ka jingero ya kani ka sian jam bar ula banjur halor ka jingdon kamban penklan ya ka jing sumar hagithan nong kendong ula penpau ya ka jing sungu ya ka Glenmark Foundation bat ka SSCH bakila shim ya kani ka sian jam da ka baong ru bakani ka Mobile Medical Unit kanwan ra ya ka jing mantoy Shibun Ïaki Paidbah.
This is our 5th Health on Wheels initiative across 7 states that we work in, and I think one of the things that I'm very proud to say it is last year we launched Boat Clinic in Assam, and it became, it actually reaches communities in Riverine where, unfortunately access to healthcare didn't exist in a long time. One of the best part is Boat Clinic actually won the biggest awards. It's called Oscars of Pharmaceuticals. It's called Scrip Award that we won this year. Health on Wheels actually at Glenmark Foundation, we work at the intersection of healthcare access and community trust. Our focus is maternal and child healthcare, and this is important because early intervention actually shape lifelong outcomes, and that's why it's very important. Our core purpose is enriching lives for a healthier and happier world. I think Health on Wheels is primarily designed as a mobile healthcare service. It's not a one-night, one-time camp. It's absolutely helping. It's going to help children who are 0 to 6 years of age, pregnant and lactating mothers. It will do preventive screening. It will actually do early counseling, social, development, behavior change counseling also here. We are very thankful to the community workers here who are supporting us. Again, I would like to sincerely thank Government of Meghalaya for their partnership. Shri Sampat Kumarji, your partnership has been hugely valued for aligning it with the straight health priorities. Sir, Dr. Celestine Lengdo, sir, thank you. Your presence here absolutely reflects how important clinically grounded leadership is. Thank you so much. And Shri Royson Nongpoh, thank you so much. Your message was so compelling. You're absolutely right. It is important, it is essential to ensure lasting healthcare outcomes for the community. Rajendran sir, thank you, and the entire SACH team. I think your passion is so important, and thank you for helping us build a lasting, translating our intent of, taking healthcare across and building or executing it so well. Thank you. We promise you from Glenmark Foundation, that this flag off of our Health on Wheels is actually our commitment to community, to our continuity, to our collaboration, most importantly, our accountability for this beautiful state of Meghalaya.
This will be very helpful because our Meghalaya has a lot of challenges in terms of geography, because we all the villages are located in the remote areas, and it's very difficult for people to access any service. So anything that is actually taking the services closer to the people is always welcoming. In fact, this is again, I think all of you know, our Honorable Chief Minister Shri Konrad Chanmaji is really providing a lot of support and focus for healthcare, providing better healthcare, especially for pregnant mothers and children, using Chief Minister's Safe Motherhood scheme, and using that we are able to provide a lot of support. And this is again, we also, in fact, last week we had a meeting in Delhi with all the CSR companies, essentially how do you actually bring, this is again a CSR effort of Glenmark Foundation. So last week we have a meeting, and today, like this week, we are having in reality. So I think this is something with the speed, the way actually things are happening in the state. I'm really, happy about it, because this is going to make a significant difference, in fact. And we also put this here because our Honorable MLA has been taking a lot of initiatives in this particular place, and this will add, to the work what he's already doing. So that's what we really wanted this, especially this Health on Wheels, which is going to go every week, 15 villages, it visits 15 villages every week. So these 15 villages, we'll also wanted to study how actually these 15 villages are doing. How like people like you, the community leaders, the Rangbashnongs, village health councils, they can really use this, because they know that like this day in a week, this vehicle will come, the doctor will come, Dr. Iba, where is she, Dr. Iba? So Dr. Iba is here, I think you can all see her. She's a doctor coming to your village, on every week. And then along with doctor, there is a nurse, there is a lab technician, tests will be done. If you have a blood pressure problem, sometimes we neglect that, because to go to the hospital, because we are busy with our own work. But now that healthcare is coming to doorsteps, you can actually get your test done, get medicines, and you can also be connected with the PHC, CSC. So it's a very good model. This is not like, it's not one of the kind of a model. I request the Glenmark team also, SACH also, if you can really implement it well, we might at a state level will take it as a model. Whereas, for example, our doctor is here, medical officer in charge of CHC, Umsning is here, I think you can see him. And maybe he has 3 doctors. One doctor can go like this. One doctor's job is only to outreach. So this kind of a model, that's what we wanted to study, this model, how this participation, I think we'll do a proper study. And if it is really working well, and then actually state government can actually bring this one across the state.
This will really bring a lot of changes in the facilities that we provide to our villages. When I think as a doctor, we find that most of the diseases that reach into complications is because we fail to detect them at the early stage. Let's take diabetes. If a proper screening is done at an early stage, we can always avoid the renal failure, we can always avoid the retinopathy, and so on and so forth, the complications that comes out of diabetes. So this is an opportunity for our general public and villagers in a special way to get themselves checked. And I'm very delighted to hear that Madam Shweta has mentioned that this machine will have, not Madam Shweta, Master Rajendran, I think, that this vehicle will be having basic pathological tests, ECG machines, and the other common tests that can be provided to the people. So I look forward to the changes, as our Principal Secretary has said. If this gives good results, it can be replicated in different areas of the state. To know that this Health on Wheels will be covering 15 villages every week, that itself is a very reassuring statement, which goes a long way into providing care to our general public. So I will not delay my speech. We will always join hands together. I hope what you start now will continue for a long time to come. Because earlier, as Rambachnong Ba'nongbri has said, something has been started by one company, but it has stopped. I hope this model will be continued for time to come. And when we talk about SACH, I am always very pleased. To every nook and corner that I go, when I see street lights, SACH is written with some banks. When I go to Kerdem Kulai, last time we went there, SACH providing computers through CSR project of different companies. So these are things, when the right group implements the CSR fund that is provided by different companies, implemented in the right way, benefits really can be seen on the ground. So congratulations to SACH, and I wish that Glenmark will flourish in the years to come and invest more. Of course, the CSR mandate has provided a certain percentage that you have to spend, but I wish that you will be earning more so that that amount will be increased.
meghalayapost.news